temporomandibular joint, when we're going to put the hand inside the client's mouth, you're going to see, you're going to put your thumb inside, so it's going to hit in here, the conjunction of temporomandibular joint, and this is TMJ. Everybody has TMJ, but some people have inflamed and contracted TMJ. Some people hold the tension in the temporomandibular joint, right? And some people don't. So when people come to you and say, I have TMJ, what they always mean is they have contracted temporomandibular joint. Now, usually when your client comes to you and say, I have TMJ, she already experiences tension and pain. Now, when somebody has a tension and pain, as a result, 100% they're going to be inflammation, because human body responds that way. You're going to have inflammation. This is a protection. Now listen to this. When we have inflammation, we have a fibrosis in there always, because while inflammation protects the area that is in pain and it's contracted, meanwhile body overproduces collagen to give extra support line. Has a temporomandibular joint inflammation because she contracts, right? There is an inflammation, body gonna make fibrosis there 100%. Right away, overproduction of collagen goes there. Other extracellular matrix comes in there to support it. It becomes stuck but survivable. And you know what happens around the tissue? All the muscles go into the ptosis. Ptosis is there fallen. Why are they fallen? Because when you have inflammation and fibrosis, the blood runs there very poorly. And blood is the only delivery vehicle that we have for nutrients and oxygen. So you're suffocating it. You still have a little blood flowing there, but a little enough to survive. In place that there is a contraction, just think about it. And when you're going to work on the client's face and when you're going to look at her, see where she's contracted. By the way, people with TMJ, when you're going to go inside, they're going to be Great Wall of China. You're going to see it. You will see. The B, if you really want to assess her, even when you're not touching her from inside her mouth, look at her face. She's going to have big indents right in here. Subcutaneous fat has already migrated. She's contracted. She's contracted means what? There is no space in there. There is no space. There is no space. It means what? That place is suffocating. It has no blood flow. No blood flow, no plump tissue. So when we work with TMJ, this is incredibly interesting work, because this is when you're going to engage your energy. We're going to talk about it in a minute. But when you work with TMJ, don't think masseter. Masseter will be taken care of no matter what. Think slowly and carefully. I need to create opening and space in here and between her muscle fibers so blood could flow in here. And once blood is going to flow in there, you are going to have lifted face. And it's going to come within an hour of facial. Now,